The Intensif handpiece by EndyMed for fractional microneedle skin remodeling may be used for the treatment of generally sun-exposed body areas such as the face, neck, décolleté, hands, and areas susceptible to acne scarring and skin imperfections. The treatment is recommended for the improvement of deep skin lesions such as deep acne scar, wrinkles, dilated pores, and for general skin remodeling. Before treatment, wash and dry the treated area to remove lotion and makeup. Clean the skin with alcohol. And apply an anesthetic cream such as EMLA for 30 to 40 minutes. We recommend covering the area treated with EMLA with plastic wrap. Before starting the treatment, clean the EMLA residues gently with 70% alcohol. Do not over-dry the skin. Connect the Intensif handpiece to the right connector when looking from the rear side of the system. Then, connect the foot switch to the handpiece connector. The Intensif treatment tip is intended for single use only. Connect the tip by using a circular motion until it is in place. When the menu screen opens, select the Intensif application. From the treatment menu, select the desired treatment area. The system will automatically set the treatment default parameters. The needle depth, power, and pulse width can be adjusted according to the test spot reaction. Perform a treatment test spot on the border of the intended treatment area, preferably non-visible, in order to assess the optimal parameters for your patient. Gently stretch the skin around the treatment spot before delivering the pulse. Place the Intensif handpiece and make sure that there is firm contact between the tip and the skin so that the needles penetrate properly. Press the foot switch. An audible signal and illuminated LED indicate RF emission. Evaluate the test spot at least 5 minutes after the pulse was delivered. If mild to moderate redness and edema is observed, or the patient reports manageable discomfort, continue on to the treatment with the same settings. In case of severe edema, erythema, or excessive discomfort, decrease the power by 2 watts and the pulse width by 30 milliseconds. If the patient doesn't feel the treatment at all and you observe no erythema or edema, increase the pulse width by 30 milliseconds or the power by 2 watts. Once the parameters have been adjusted, you can perform Intensif treatments using the Intensif template, which enables easy positioning of the handpiece during treatment to ensure uniform coverage of treatment area. Place the template on the intended treatment area. Use a soothing cream such as Biofine or a moisturizer and spread the cream on the template holes to create a uniform matrix grid on the skin. Position one corner of the upper edge of the Intensif tip on one of the outside dots of the grid, so the surface of the tip covers the first area to be treated. Deliver a pulse. Lift the Intensif handpiece and position the same tip corners on the next grid dot so that the upper edge of the tip now covers the next area. Deliver a pulse. Continue the treatment throughout the grid. When treating sensitive or bony areas such as the periorbital or perioral areas, forehead, temples, or jawline, it is necessary to reduce the power, the pulse duration, and the needle's depth. To do so, press the pause button. Decrease the parameters, and press the start button again. Continue this procedure for full and uniform coverage of treatment area. For enhanced clinical effect, it is possible to cover the area with additional passes of pulses. Do not stack pulses. For additional clinical enhancement, it is also possible to perform 2 to 3 pulses with the RF set to 0 for further enhancement of the microneedle effect. It is recommended to gradually increase the treatment parameters according to need from treatment to treatment. Following the treatment, mild to moderate edema or erythema will appear for a few hours. Clean the face gently and apply soothing cream to soothe the redness and heat sensation. After the treatment, patients should pay attention to the following guidelines. Do not use makeup on the day of the treatment and keep the face completely clean. Avoid using peeling products or exfoliates. Minimize sun exposure following the treatment, and in any case of sun exposure, apply a high-potency sunscreen for up to a month after treatment. Men should avoid shaving for a week. Apart from these guidelines, patients can immediately resume all their normal activities. Following the treatment guidelines in the tutorial will ensure optimal results and customer satisfaction.